Hello everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So in my last video, we have started with the respiratory assessment where we have discussed in detail about what are the various information we must collect when we are performing the history collection. We've also discussed about few of the symptoms which will always be present in a client if he or she is having respiratory problems, and also we have started with the physical examination where we have discussed in detail about the inspection. So in today's session, we are going to continue where I will be teaching you about the palpation, percussion, as well as the auscultation. So here, palpation is an assessment technique in which the examiner will be using the surface of the hands and the fingers in order to detect if there is presence of any abnormalities. The assessment data which can be collected through this process of palpation include identifying the chest movement, identifying whether the chest is symmetrical or not, identifying if there is presence of chest skeletal abnormalities, if there is presence of swelling, if there is presence of tenderness, presence of masses, as well as if the temperature of the skin is abnormal. So how will you palpate? Here, in order to assess the symmetry of the chest expansion during breathing, what we can do is that we can tell the client to stand in front of us, and then what we must do is that we must place our hands with fingers spread apart beneath his or her arm on the side of the chest about 2 inches below the axilla. So here what we will be doing is that we will be telling the client to stand in front of us, then we will be placing our hands beneath the arm on the side of the chest about 2 inches below the axilla. And when we do this, we need to make sure that we must spread our fingers apart, and also you need to make sure that your fingers should be pointing towards the anterior chest. Why towards the anterior chest? Because if you do this, it will let you feel the chest when it is rising and falling during the process of inspiration and expiration. So here when you are doing this, what you also need to do is that you need to ask the client to breathe out completely. And when he or she is breathing out completely, you must observe your hands and thumbs to see that they have moved equally on both sides. So here, in order to assess the symmetry of the chest expansion during breathing, this is what you can do. And after you have done assessing the symmetrical of the chest expansion, next what you need to do is you need to feel for the tactile fremitus. Fremitus refers to the vibratory tremors that can be felt through the chest whenever you are performing this palpation. In order for you to be able to assess this tactile fremitus, what you can do is that you can tell the client to say 99 or blue moon. And when the client will be doing this, when the client will be speaking, you need to make sure that you palpate the chest from one side to the other. Why? Because this tactile fremitus is mainly found over the main stem bronchi near the clavicles in the front or between the scapula in the back. So here, as soon as you will be moving your hand downward and outward, you should also make sure that the fremitus must also decrease. So here, when you are performing this and when you find that there is decreased fremitus in the areas where fremitus is normally expected, then it can indicate that there is presence of obstruction of pneumothorax or of emphysema. And if there is presence of increased fremitus, then it may indicate the presence of compression or consolidation of the lung tissue, as these usually occurs in clients who may be suffering from pneumonia. So these are the various information which you can get when you are performing the palpation. However, the normal findings on palpation include the normal chest size and shape. The skin will be warm. There will not be any tender spots. There will be a symmetrical chest expansion, and also the tactile fremitus will be present over the mainstream bronchi in front and between the scapula in the back of the chest. So in short, I can say that when you perform this palpation, you will be getting the idea of the chest shape, of the size, of the presence of the tactile fremitus, as well as of the symmetrical chest expansion. Now moving on to the next, that is the percussion. So as I've said, that percussion means tapping, right? This percussion is an assessment technique which will be producing a sound when the examiner taps on the chest wall of the client. Just like when you tap a container lightly, the container will be producing some sounds, right? So here similarly, tapping on the chest wall of the client will also produce some sound based on the amount of air which is present in the lungs. This percussion also sets the chest wall and the underlying tissue in motion, which will be producing an audible sound and also palpable vibration. This percussion also helps us to determine whether the underlying tissue is present with air, with fluid, or solid material. So whenever you want to perform this percussion on the anterior chest, then it can easily be done when the client is in a lying position. However, if you need to perform this percussion on the posterior chest, then it is best done when the client is in a sitting position. So here, after the client has taken the appropriate position, then what you can do is that you can place the first part of your middle finger of your non-dominant hand firmly on the skin of the patient. Then you must also strike the finger which is being placed in the skin of the patient with the end of the middle finger of your dominant hand. So here, as I have said, that when we want to perform this percussion on the anterior chest, then the client must be in a lying position or in a supine position. Whereas if we want to perform this percussion for the posterior chest, then the client must be in a sitting position, right? So after the client has taken this position, then what we must do is that we must place the first part of the middle finger of our non-dominant hand in the skin of the client. Then we must strike that finger which is being placed in the skin of the client with the tip or with the end of the middle finger of the dominant hand. So here, as I have said, that if you want to perform this percussion on the anterior chest, then the client should be in a supine position. Whereas if you want to perform it for the posterior chest, the client must be in a sitting position, right? So after the client has taken this appropriate position, then what you must do is that you must place the end of the middle finger of your non-dominant hand on the patient's skin, and then you must strike that finger which is placed on the skin of the client with the end of the middle finger of your dominant hand. So here you must make sure that you must never place your dominant hand, but you must place the middle finger of your non-dominant hand on the skin of the client. And whenever you perform this percussion, you must make sure that you work from the top of the chest to downwards. That means you must go from up to down. And while you are doing this, you must make sure that you compare the sound which will be heard on the left as well as on the right side of the chest. And as you proceed, you must also visualize the structure underneath. So when you are performing this percussion, then you can either hear a resonant sound or a dull or thread-like sounds, right? So what is this resonant sound? This resonant sound is a low-pitch, hollow sound which is normally heard over the tissues of the lungs. A flat or an extremely dull sound is usually heard over the solid areas such as the bones, and a dull thread-like sounds are normally heard over the dense areas such as the heart or the liver. This dull sound or this dullness can also sometimes replace the resonant sounds when the fluid or the soft tissues replaces the air-containing lung tissues, and this condition is usually seen in clients who may suffer from pneumonia and also from pleural effusion or tumors. And also the hyperresonant sounds that are louder and low-pitched than the resonant sound are normally heard whenever you are performing this percussion on the chest of the children or on the client who are very thin. This hyperresonant sound can also be heard when you are percussing the lungs, which has been hyperinflated with air. And this is commonly seen in people with COPD or on those who have acute asthmatic attack. And if you find that on one side of the chest there is an area where this hyperresonant sounds is heard, then it can also indicate that the client may be suffering from pneumothorax. And when we perform this percussion, we can sometimes also hear the tympanic sound. This tympanic sound is a hollow high as well as a drum-like sound. And this tympanic sound is normally heard over the stomach, right? So if you perform the percussion of the chest and if you hear this tympanic sound, then this can serve as an abnormality. This can give you an idea that there is some abnormality because this sound is not heard over the chest, but it can be heard over the stomach. So if you find that this tympanic sound is heard over the chest, then this can be because of the excessive air which may be present in the chest, and it can also occur in cases of pneumothorax. So while performing percussion, if you find that this tympanic sound is heard over the chest, then it can be because of the excessive air which is present in the chest, and this can also occur with pneumothorax. And then moving on to the last step, that is the auscultation. So auscultation is the technique of listening to the sounds which will be produced by the body of an individual, right? So while we are performing this respiratory assessment, when we will be auscultating the chest of the client, we will be listening to the sound of the chest with the use of a stethoscope. Why? Because here, when the air moves in and out of the respiratory system, there will be a sound which will be produced, right? And these sounds are known as the breath sound. So these breath sounds are transmitted through the chest wall and may be heard through the diaphragm of the stethoscope when it is placed firmly against the chest wall. So here the auscultation of the lung is one of the most important examining technique for assessing the airflow through the tracheobronchial tree. So here when you are performing this auscultation, you must ask the client to sit with his arms folded across the chest and the hands resting, if possible, on the opposite shoulder. Why? Because by being in this position, it helps to move the scapula out of the way, and it also increases access to the lung fields. And you must also instruct the client to breathe deeply with his mouth open, and while you are doing this, you must make sure that you listen carefully for at least one full breath in each location. And also not only just listening, but you must also observe whether the patient is having any symptoms such as lightheadedness or fatigue, and if so, if these symptoms are present, then you must advise them to take adequate rest. And you must also instruct the client to breathe deeply with his mouth open, and while he is doing this, you must make sure that you listen to at least one full breath in each location. And not just listening, but here you should also observe if there is presence of symptoms like lightheadedness or fatigue, and if these symptoms are present, then you can tell them to take adequate rest. So in short, I can say that this chest auscultation is done in order for us to be able to listen for the sounds which will be generated by the normal breathing, and also to listen or detect if there is presence of any adventitious or added sounds. So now here we have come to the end of this topic. So in this session, we have discussed about the palpation, the percussion, as well as the auscultation. So if you have viewed the first part of the video, then I hope by now you might have got a clear idea of the respiratory assessment, of what are the various information that you must gather when you are performing the history collection, as well as what are the various information that you need to find out and you need to get when you are performing this physical examination, which include the inspection, the palpation, the percussion, as well as the auscultation. So I will end this topic for today. So I'll be meeting you guys in another session whereby we will be dealing with the normal breath sounds, where I will be telling you about what are the normal breath sounds that you will be hearing, as well as when can you consider the breath sound abnormal. And we'll also be discussing about few terms which is very necessary for us to know, especially if we want to detect or if we want to understand what are the exact respiratory problems that the client is having. So until then, have a good day. Thank you.